I've been going to Bolivia for about 5 years now. The most recent trip was March of this year, and when we went there, I had met Jose. Jose was a child who had a mass in his nose. They had a preliminary CT scan there, and when we looked at it, it was obvious that it was someone that we could not operate. We had operated on his sister who had a similar mass. It was much smaller than Jose's, and so we were able to make a small incision through her forehead and take care of that there without having to require an ICU stay. Jose, on the other hand, when we looked at a CT scan, which was a very rough CT scan, it was very obvious that we would not be able to safely operate with him there.
Well, I think part of being a doctor is doing anything you can to help people out. And Johan had approached me about this young gentleman who's had a really difficult time and this deformity that's really affected his life and his ability to interact with other folks. And I really wanted to do anything I could to help him out.
We're very blessed in the United States. I think we are a very rich country, and if you leave outside the U.S. and especially somewhere in South America, poverty is everywhere, and they live in basically a one-room house, which is basically a cabin up in the mountains, and it's about 130 miles away from a major city called Santa Cruz.
Dr. Han had taken so much time to help coordinate the surgery and all of the efforts in bringing him here and coordinating the anesthetic time and the facilities and things like that. So I thought it was the least I could do to be able to help.
The part about his history that made it convincing that he had a problem when we saw in Bolivia was not only did we see the pulsatile mass that was pressing through the bone and the skin, but he also had headaches. He also had problems with his vision. And he also had the symptoms of meningitis, which was the high fevers, the neck stiffness, the difficulty with bright light. Those are consistent with meningitis, meaning an infection in the brain. And he was very fortunate that the infection did not spread further and was well contained with the antibiotics.
When we looked at the CT and MRI scan, we found out that it wasn't the nasal glioma that we thought it might be, and actually it was what's called an encephalocele, where basically he had increased pressure on his brain that over time it caused the brain to kind of move through some of the bones of the skull and basically destroyed or kind of changed the way that the bones down over the bridge of his nose and on the nasal bones themselves kind of grew with a big defect, basically, where this brain had kind of come out up next to the skin.
Nasal frontal encephaloceles are very uncommon, and it is so uncommon to the point that most physicians don't want to take care of them. So they usually refer them to a medical school like Eastern Virginia Medical School, otherwise known as EVMS. And here at EVMS, we have a great group of physicians where we can work as a team, and as a team bring our own specialties to the patient and provide excellent care for that patient. This is Jose's CT scan, and this is a view where we cut his face and what we call coronal, and that's cutting it from the front and working our way back. This is the right side, this is the left side, and you're going to see three colors: white, which is bone; black, which is air; and gray, which is soft tissue. Now, as we scroll back on his face, you can clearly see the bone, and the bone is supposed to go around in a circle, but the bone is missing here.
So Dr. Singh and I, the neurosurgeon, started off elevating those tissues and taking the forehead bone off to see the brain, and actually had noticed that the brain was very swollen from all of the pressure that he had that caused it in the first place. So Dr. Singh was able to relieve some of the pressure to get the brain to go down some.
There's the brain, and so the brain usually stops right about here. But you can see the brain coming into the nose on the right side and on the left side. And that's a little bit of some of the extra brain tissue that's there.
After that point, I came in and was kind of assisting Dr. Singh, but then kind of took over at that point, where I took out all of the tissue that was over the nose, underneath all of the scar tissue, and what was kind of causing his real deformity that people would see, and removed all of that tissue. At that point, he didn't have any bone structure here, so everything was just kind of a big divot, for lack of a better word, so we had to reconstruct that area. We had taken the bone from the inside portion of the skull, and then kind of sculpted that bone into to reconstruct this area, divided it into two separate pieces, which basically would kind of create the pyramid that you have over your nasal bones, and was able to bring that bone up and secure it up to the bone that was still here, basically recreating a whole new bridge to his nose.
The operation, it was an all-day event. It took us 9 hours. Half of the time was used to resect the part of the brain that was going into the nose. The other half of that time was used to reconstruct the hole that we had made. Jose had a very large operation, and I don't think it would be difficult for one physician to do this whole procedure, meaning taking out the piece of the brain that was going into his nose and reconstructing it. I don't think there's one doctor who could do that well altogether. So after the long procedure, then we take him to the intensive care unit, and he'll probably be in the intensive care unit for about 2 to 3 days, and then when he's stable enough, then we should be able to take him to the floor and watch him there to the point where he can start walking and eating and going to the bathroom without any problems. Then he'll go to someone's house, and what's great about it is there's been a lot of people who have volunteered to kind of take care of him for as long as he needs to get better so that he can fly back. I think the best part of this whole event is that we have the skill and the technology to take care of someone like him, and even though it's a very complicated surgery, we're able to make it very easy, and so that we have very low complication rate, and that he will be able to do well and recover quickly.
Over the next few weeks, he'll start to look start to look the way we want him to, and over this 6 months to a year, you will really notice a difference. This opportunity to care for Jose was only made possible through the support of Eastern Virginia Medical School, the physicians involved, as well as Sentara and all of their support with providing the operating room, the anesthesiologist with the post-operative care, a hospital bed in the intensive care unit, and we would never be able to perform these kinds of procedures and give our time without the help of these other institutions.